The impact of Oklahoma's budget crisis on agencies like the Department of Human Services could literally mean the difference between life and death. For those who work for or with the DHS, say the agency is in dire financial shape and the people they serve are facing a perilous future.
I know. I gotcha.
Kelly Peterson orchestrates a balancing act that can be knocked out of kilter if one peg of the family routine gets out of place. When not at work, she cares for her 87-year-old mother and a son with a developmental disability. Each morning, Kelly dresses her mother, Betty, in the stylish, professional manner she was accustomed to until retiring at age 78.
She worked hard every single day of her life, and now at 87 years old, she deserves a whole lot more than what the state of Oklahoma can provide.
Kelly depends on the Department of Human Services Advantage Waiver Program that's administered by Tulsa's Life Senior Services.
It saves dollars by keeping people at home rather than in a nursing home where it becomes more expensive, but it also does something even more important. It keeps them healthy in their own home.
The Advantage Waiver Program pays for Betty's adult daycare. Before heading to work each morning, Kelly takes Betty to Life Senior Services, where she joins enrichment programs like exercise sessions. Kelly knows her mother will be well cared for here from 9:30 to 5:30. A transit bus delivers Betty home, where a personal care assistant meets her needs until Kelly gets home at 8.
And that is the reason the Advantage program allows me to have a full-time job. I would not be able to work full-time without this program.
In a recent letter to providers and partners, DHS Director Ed Lake wrote this about budget cuts coming to DHS. To give some perspective to the worst-case scenario of the 14% figure, a cut of that magnitude would mean an actual reduction of $147.5 million from our current state dollar operating budget of $733 million, and cause reductions to or elimination of entire programs providing critical health and safety services for vulnerable seniors, people with disabilities, and children. Kelly and many others in similar situations fear cuts to or the loss of the Advantage Waiver Program will lead to catastrophic consequences. 78-year-old Sandra Hall says without the waiver program, her future is sealed.
Will I be dead, number one? That's bottom line.
Sandra says she's disgusted with the legislature.
And I think what's going on with the government is just a travesty of justice. I'm very opinionated. Our schools, and to take and cut our children and to cut the old people, it's wrong. It's just wrong.
Sandra pays her own rent and utilities, but she needs someone else to help manage her needs. That's where Alicia Ogle comes in.
I heard that you have a new aide this month. Is she working the whole time?
For 12 years, Alicia has been Sandra's Advantage Waiver Program case manager. Alicia meets with her monthly to coordinate the care Sandra needs. Alicia has a caseload of 43 people.
I could tell you about half of my caseload, if they did away with the program, half of them would go into nursing homes within a few weeks. I don't know if there are spaces in nursing homes, let alone who wants to go there.
Alicia works closely with DHS.
It's been my observation since these budget cuts that DHS is down to a skeleton crew, and I don't even think they have all their bones. And now the few people that have been left behind, I just can't fathom what their desks must look like, the stacks that they're having to review.
Alicia says in the past, a change order for something as simple as ordering a different size undergarment for incontinence usually had a turnaround time of 24 to 48 hours. Now she says it could be weeks.
Without the personnel there to review our plans, what's happening is that there are serious delays in getting services out to people.
And those services are being cut. A personal care assistant is available to Sandra for 17 hours a week, more hours than others receive.
The aide has to work really hard and really fast to get all of the tasks done in shorter amounts of time. If you ask for anything over 10 hours, it's scrutinized.
Sandra hopes lawmakers are listening to this story.
Quit fooling around. I've been to some of those legislature things where they just play and drink coffee and put their feet on the desk, and get with the program, people, and get serious about this stuff. Find the money to help Medicare and Medicaid and the school system.
The people interviewed for this story say they have never seen state government in such bad shape.
I can't imagine not being able to come here every month. I can't imagine people out here without help. It literally seems like the legislature would be sentencing people to death. And I've never felt it's been that bad before. Not that bad.